Just a quick introduction. Some of you may have seen before, I'm the Health and Fitness Service Manager, so my job really entails just looking after the fitness services, members, fitness operations, gym equipment, gym services, studio, class and that sort of thing. And Lisa works as an instructor and also club lead, so she's integral to what we do here with our club programme. We've got the club lounge, and we've got club activities that we do. The club generally means for like over 55, some of you may be, some of you might not be, a bit younger. Today is one of our coffee mornings, and what we do is every other month we try and have a little coffee morning where we have somebody present, somebody who's an expert in their field, somebody who does a presentation and talks about an area of sports or fitness or health. Today we've got David Powers, who's our resident osteopath. He's going to do a small presentation talking to you about generally what he does, how he can help you with any issues and problems you have, any back problems, neck problems, anything he can do to help you with any sort of minor injuries you have that you sustained previously or while you're training now and in the future. So, is there anybody here that's new to the centre that's not one of our members? Just raise your hand here today. Anybody just coming on from you? We just need to take a register today of who's turned up, so we're going to have a list and just put your name on there. There are some beverages and tea and coffee that we'll provide afterwards, and some small snacks. Also, at the end of the presentation, there's an opportunity we're doing some mini health checks. So what we're going to be doing is some checks which involve blood pressure, resting heart rate, BMI, a mini sort of fitness test, which is just a sit and stand test, and a flexibility and mobility test. Okay, so you can do that afterwards. We've got some of the equipment there. If you're interested in doing that, we can go through it afterwards. We give you readings and whether they're good or bad or need improvement, that sort of thing. So just going to let David kick off with the presentation. It lasts about 15 minutes. There will be question and answers afterwards, so if you do have any questions around the presentation, you can ask afterwards.
And just after the presentation, we have there all the machine, blood pressure, BMI, also all the things to do a test. So with the manager, Daniel Oriot, we go through. If some of you want to check the level of flexibility, how is flexible your back, how flexible we can go through the test. Okay, and after one moment, I take the name of the new people and I give it to you. There are
we can do it at the end, it's fine.
Okay, at the end, so I will give you the free advance for 1 minute. Sorry, I'm not.
Okay.
Fine.
Hurry. And there's another lady.
Another one. Okay, so I'll pass you to David. David, you give a round of applause for his first presentation.
Okay, good morning everyone. Thanks Danny and Annalise for inviting me along today. It's probably going to be about 20 minutes or so my talk. I was asked a few weeks ago to do this, and I haven't done a great deal of public speaking or speaking in front of people before, so I think the guys would have liked me to have talked for 30 to 40 minutes, but unfortunately I've actually got to get working about 25, so it may be a little bit short and a little bit rushed, but if you enjoy it I can come back again in the future and do longer. Anyway, as you can see from my slide, the topic of my talk today is osteopathy, what, how, why, and the importance of maintenance. So today is essentially my 15 minutes of frame. I've tried to split it into roughly 5 sections: an introduction, then some explanation and answers, what do I do, most importantly, how it can help you, and lastly, I've got an offer for you all because you've actually spent the time to come and sit and listen to me babble. Anyway, let me tell you a little bit about me. So, as I said, my name is David Powers. I'm the osteopath here at Copthall. I've been here for about 15 years or so. Now, I graduated about 20 years ago from a place called the British School of Osteopathy. At the time, there were about 3 or 4 places to train to be an osteopath in the UK, and the BSO was meant to be the best. The reason I became an osteopath was because I actually wanted to treat animals, specifically horses. And the only way to treat horses was you had to become a human osteopath first and then specialise. So I graduated in '96. I worked just on people at first. Then I started practicing on my own horse because I ride. and I then did further study, so I'm now a human and an equine osteopath. I currently split my time roughly 75% human and 25% horses. My long-term goal is to cut down a little bit of what I do human-wise and increase the horse side of my business. So my practice here, I actually work Monday, Tuesday and Thursday. There's another osteopath who works with me and a masseur. So we offer a service 5 to 6 days a week and evenings, sometimes on the weekend if necessary. So, what is osteopathy? I imagine some of you have been to see an osteopath at some point in the past, if not a chiropractor or a physio. I came up with a good description here, and it's osteopathy is a method of assessing, treating and preventing a wide range of health problems. Osteopathy is a combination of movement, stretching, targeted deep tissue massage and manipulation of a person's muscles and joints to improve function, relieve pain and aid recovery. I think that's pretty spot on. That's what I do most of my day. But do any of you know where it came from? Well, it actually started in the late 1800s with a guy called Andrew Taylor Still. He was a surgeon and a doctor in the States, and he was quite disillusioned with medicine. I think he found that medicine was actually killing more people than it was curing. So he discovered that to achieve the highest possible form of health, all parts of the body should work together harmoniously. So essentially, by improving structure, you can improve the function of the body. So what can osteopathy be used for? I think most people assume that osteopaths are backs and necks. And certainly that's what I spend a lot of my day doing. Probably, I don't know, 60, 70% of my day are backs and necks. But we treat shoulders, elbows, wrists, knees and ankles. I even treat some jaws. Not that often, but I do some jaws. So, age range of people. I reckon the common age for people coming to see me is around about 40 to probably mid to late 60s. Currently, about 50-50 male to female. It used to be a little bit more female to male, probably 60-40. I don't know what's changed, perhaps that's just the clientele that I attract. So one of the common questions I get asked is what is the difference between osteopathy, physiotherapy and chiropractic? I think it's probably easier to start with what are the similarities. Well, we're all described as primary healthcare professions. We all currently train to either BSc Honours or Master's level. Currently, osteopaths and chiropractors train for 4 or 5 years, physios train for 3. Osteopathy and chiropractic is mainly hands-on, meaning if you come in and see me for some treatment, lay on my table, I'll actually do something to you with my hands. Physios, and this is a bit of a generalisation, tend to use more machines and exercises to treat their patients. Certainly as time goes on, there seems to be overlap, and I certainly recommend exercises for a lot of my patients so that they can go home, do them themselves, and it cuts down on the number of sessions they have to have with me. I think long term the sensible thing would be that osteopathy, chiropractic and physiotherapy all join together as one profession, because there's good bits and bad bits in all of them, and if we could just amalgamate the good bits, we'd have a great profession at the end. So, how can osteopathy help you? Well, in the UK, the National Institute for Clinical Excellence actually recommends osteopathy as one of the treatment options for non-specific low back pain. Some GPs refer to osteopaths. You can, however, self-refer if you're willing to pay. Most private medical insurers will provide cover for osteopathic treatment. You need to just give them a ring, say that you'd like to see an osteopath, and they'll give you an authorisation code and the number of treatments you're allowed. Early treatment is proven to improve outcomes. Most patients report an improvement in their symptoms immediately after their treatment, and it's very, very safe. So, how can you help yourself? Well, some of this might seem a little bit obvious, but perhaps it just seems obvious to me because I spend my day telling people to do it or not to do it. So let's start with the obvious one. Travel as light as possible.
Sorry.
Avoid carrying overloaded suitcases. Use wheeled cases or trolleys. When lifting, keep the load close to your body. Now, I assume most people know this, but it's bend your knees, keep your back straight, keep the weight near to you, lift up straight. Twisting or lifting awkwardly increases the risk of hurting your back. Now, this is the reason I see the majority of people. They come in because they've bent over and twisted. Well, I think we all do it. You know, you're at home, you bend over, you pick up the washing. I don't know, you sweep up on the floor. It's always that bend and twist because it saves time. And 9 times out of 10 you'll be okay doing it. It's that one time you bend and twist and your back goes. So this next one's quite interesting. Don't spend too much time sitting in the same position. Now, some of you might have heard that sitting is the new smoking. I.e. sitting is terrible and that we should actually stand up more. Standing isn't the answer either. Nowadays, a lot of standing desks are becoming quite popular. So you've got your tablet or your laptop up here. But it's just as uncomfortable to stand there for hours and then you end up leaning awkwardly on it. The answer is movement. Most of us have got mobile phones, most of us have got, well, some of us have got a watch that you can set a timer on. Ideally, get up every 20 minutes. Realistically, get up every half an hour. Wander around, make a cup of tea. Okay, anyway.
Excuse me, sorry, because one lady brought a comment.
Oh, sure. Okay, so that's quite a bit of talk really about osteopathy. Now, this is probably a bit more of interest to you. What actually happens when you go and see an osteopath? Well, the start of the consultation actually starts really with you making the appointment. Because you're going to ring me up, we're going to have a chat about your problem or whether it sounds like I can help you or can't help you. And if it sounds like I can't on the phone, I'm obviously not going to make an appointment for you. I'm probably going to push you in the direction of who I think is right for you. But let's make the assumption that it sounds like I can help you with it. So you'll come in, I'll take some basic details. Now these are going to be what you'd expect: the name, age, height, weight, GP details, exercise levels. But then I move on to the actual case history. So I want to know about where it hurts. So if we use let's use the shoulder as an example. You come into me with shoulder pain. Now, where exactly is your shoulder? Because the shoulder's quite a large area. So, is it here? Is it here? Is it here? Or do you have pain that comes from here all the way down here? How long have you had that pain? What is the character of the pain? How did it start? Now, the reason I'm asking these questions is I'm trying to work out the structure causing your symptoms. I then want to know how long you've had the problem. Has it just come on? Did you wake up with it? Or has it been niggling in the background for weeks, months, years? Because we need to be realistic about what I can do for you. If you've had a problem for 5 years and it's just niggling away, I can probably make it a lot better, but I might not be able to cure it. So I might be able to get it to a point where you're happy with it and then give you exercises, which means you can manage it. So I then start asking about your past medical history. Have you had any accidents, any illnesses, any operations, anything that could contribute to your symptoms. So, what's a good example? Okay, let's say you come into me with right-sided low back pain and right hip pain. But 5 years ago, you had surgery on your knee. Let's say you had a thing called arthroscopy, which is quite a common procedure nowadays. It's where the knee is essentially cleaned out. But once that knee is cleaned out, it doesn't function as well as it should in an ideal world. So you've got a knee, which doesn't work as well as it should do, and you come in with right-sided hip pain. Now, yes, I can work out what's causing your hip pain, but unless I manage your knee as well, so perhaps give you some rehab exercises to fix the knee, I'm not long-term going to fix your low back and hip problem. I then ask what's known as systemic questions. So I'm trying to get an idea of how healthy your gastrointestinal system, cardiovascular and neurological systems are, just to see if any of these are contributing to the symptoms that you presented with. After that, I move on to the physical side of the examination. So this is where I'm actually going to use a friend of mine, Sean. Right, now the physical side of the examination would actually start the minute you come and knock at my door. Because I'll have opened the door, I'll have seen you walk into the room, I'll have seen you sit down. We've sat down for roughly 20 minutes while I take a case history. Then I'm going to ask you to strip down to your underwear. Now, not everybody's comfortable with stripping down to their underwear in front of a stranger, perfectly understandable. So a pair of shorts and a sports bra for ladies is absolutely fine. But the more I can see of your back and your joints, the better it is for me. I'm not going to ask Sean to get
I don't have my sports bra today.
So, let's imagine Sean is down to his wife fronts. Okay, I'm going to have him standing by a mirror, facing a mirror, and I'm going to start by walking around him, and I'm looking at how is he weight bearing. Is he straight? What are the levels of his ankles, his knees, his hips, his shoulders, and his ears? Now, in an ideal world, if you can imagine I've drawn lines across all of these points I've mentioned, what I want are straight lines parallel to the floor. In the real world, it doesn't really happen. In the real world, we're all a little bit wonky. So a generalisation is that if you are, well, whatever side you're dominant, so if you're right hand dominant, your right shoulder is often a little bit low and the right side of your pelvis is high. So you would be like that. So once I've observed Sean, I'm going to ask him to do some movements for me. These are what's known as active movements. So if I can have you facing that one, please. So I'm only going to focus on his spine today, otherwise I'm going to be here all day going through the joints. So let's start with his neck. So I'm going to ask him to drop his head forwards and back up. Look over your left shoulder, your right, back to normal. Bring your left ear to your left shoulder, and to the right, back to normal, look up at the ceiling. Back to normal. Now what I'm looking for here mainly is range and quality of movement. How well does his neck move, and how far does it move? I would like the distance to be good, and the quality of the movement to be good. So an analogy is perhaps opening a door. Ideally, you open the door, once you turn the handle, the door's going to swing nice and loosely. Some doors, you open them, you've almost got to give them a good kick so they're so stiff. So what I see with Sean's neck, it's pretty good so far. So then we move on to the trunk. Now, the trunk isn't one particular area. The trunk consists of the thoracic spine, which is the middle, the lumbar spine, which is the bottom, the attachment from the pelvis onto the spine, which is called the sacroiliac joints, and the hips. So I'm going to ask him to bend forward and touch his toes on the floor. Okay, nearly. Come up. Run your left hand down the outside of your left leg. Back up and to the right. Back to normal. and lean back. Okay. Again, looking for range and quality of movement. Okay, Sean, that's great. Thanks. Okay, so once I've done what's known as the active movements, I then move on to orthopaedic and neurological testing. So this is where I'm trying to narrow down further the structures causing the symptoms in him. And from there, I move on to what's known as passive examination. Passive examination is generally with the patient lying on their back on the table. And this is where I'll put each joint through its full range of movement, looking for range, quality, hypertrophy, which is an increase in tone, or a decrease in tone. Increase in tone of muscle, or a decreased tone of muscle. So, all of this information I then put together, and I'll then explain to the patient what is wrong, what I can do about it, how long it's going to take me to fix it, and what the patient can do for themselves. Right, why should you come and see me? Right, looking around the room, I'm going to assume that most of you have got a car. And I'm going to assume that probably most of you drove here today. So I think that it's pretty important your car to you. So I suspect that you put it into the garage and you get a regular service on it. Another analogy is your teeth. Now, I certainly go to the dentist every 6 months, I go to my hygienist every 3 months, and these are checkups. Now, I don't go to the dentist because I've got toothache, I go because prevention is better than cure. Now, this is exactly the same with your body. You need to get regular checkups on your back and your joints because you're using them all the time. I'd suggest at least every 6 months. So, from there, that leads on to the thing that I haven't mentioned today, which is cost. I normally charge £60 for the initial consultation. For that, you get approximately an hour of my time, you get case history, examination, treatment plan, and any rehab exercises. But because you've actually sat through me talking today and hopefully not nodded off, I'm going to offer you half-price deal. So, for the next week, if you book an appointment, it'll be £30 for all of that. Anyway, thanks for listening. I hope that was of some use.
Yeah, thank you very much. Thank you. 10.
Yeah, I've got about 4 minutes. Are there any questions?
What's the difference between osteopathy and osteoarthritis?
Okay, well, osteopathy is treatment. Osteoarthritis is a condition of the joints, of degeneration of the cartilage over the end of bones. So if you imagine you've got 2 joints here, doesn't matter, or 2 bones here, on the end of bone you have cartilage and cartilage. Arthritis is when those smooth surfaces of cartilage rub away, and instead of having smooth surfaces, you get roughened surfaces. Osteopathy is treatment of the symptoms associated with musculoskeletal conditions.
Dave, just ask quite a common question, I think, is the difference if someone's had an injury, whether they go to physio, osteopath, chiropractor, how's it differ, and how does someone choose the person to go and see? Is there a difference?
I think it depends on what damage you've done to it, which I would essentially triage on the phone when I speak to you. So if it sounds like you've done a serious injury, I'd probably send you to hospital first to get an X-ray and an MRI scan before coming in for treatment. I then think it's down to what type of treatment you like. If you're the type of person that likes doing exercises and will do them, then physio may work for you. But if you prefer to take less responsibility for yourself and have someone do it for you, then osteopathy and chiropractic are better.
So
back or you possibly pinched a nerve,
Yeah.
who would you go to first? An osteo or a chiropractor? And are they complementary or one and the same? Could you have both?
I'd probably answer it slightly differently. I certainly wouldn't say see them both. Our goal is, we've both got the same goal, but I think we go about it slightly differently. As a generalisation here, osteopaths see their patients a little less than chiropractors do. So if you were to come in to me with an acute injury, I may see you twice in the first week and then weekly for a few weeks after that. Chiropractors are more likely to see you a few times a week for a few weeks. I can't answer in an unbiased way what is best. It's probably down to what your preferences are. Chiropractors do a bit more of the manipulation to backs and necks. By manipulation, I mean the clicking that some of you may have experienced when you have treatment. So I can't do it to myself, but you know, a bit like cracking your knuckles. Well, osteopaths and chiropractors do a lot of this manipulation to mainly necks and low backs. But in general, chiropractors do more of that, and osteopaths work more on the soft tissue.
Can I just talk about my experience, just for 2 seconds? I'm a power lifter. That's my sport that I do. I lift heavy things. Find it fun to move and lift heavy things. I injured my back, and I've actually been to all 3 up.